I am Keisha Nuevo from BSN 11G, and today I will going to perform bed bath. A bed bath means to wash someone who is in bed, and it is important because it cleans the skin and helps the skin be free from infection. It also helps the patient to relax and help him to feel better. Next, wash the hands and provides privacy to avoid infection and cross-contamination, and no one can disturb outside, and all the assessment kept confidential. Prior to the conduct of the procedure, I have performed hand washing to protect myself and my patient from infection and cross-contamination. Have closed the door and curtains, adjusted the room temperature, and provide adequate lighting to ensure the patient's comfort and secure my patient's privacy. Next, identify, explain, and assess the patient to know that I do right assessment to the right person who assigned to me, and so that the patient will know what will be conducted to them. So, good morning, ma'am. I am Aisha, your student nurse for today. May I see your hand, please? Please state your birthday and your name, please.
I'm Ipit and
Okay, thank you. So, how would you like me to call you? So, today I'll be doing bed bath, which means that I'm going to wash your body and remove your accumulated dirt and oils or respiration in your skin, and of course make you feel refreshed and feel relaxed. Okay, Ivy? Next, over the bedpan or urinal and ask client to void so that the patient will be using if they want to be. Okay, they want to be. You want to void? Okay. Bring necessary equipment and wear correct PPE wear glove. To conserve time and energy, and the glove is to protect myself and my patient from infection and cross-contamination. Okay, so the equipment needed are the a wash basin with warm water 40 to 46 degrees Celsius, soap bleach with soap, working gloves, bath towel, bath blanket, wash clothes, deodorant, powder, lotion, eye drop, comb, eye patch, and the table for the equipment to place. Raises the bed to a convenient working height and lowers side rails near the nurse so that the patient be comfortable and will not be so that far when the nurse doing the assessment. Okay, are you comfortable with your position right now, Amy? Okay. Assist the patient in the side of the bed so that the nurse will not be experiencing difficulties in performing the patient. Okay, you are now on the side of the bed. Places the bath blanket over the patient and remove the soiled top sheet beneath the places into the hamper. To change the blanket of the patient to a bath blanket for bathing them. Can you hold this for me? Remove the patient's gown if the patient has an intravenous line injury or reduced mobility. Begin on the unaffected side. To be able to start the procedure and bed bathing and removing it already will conserve our time and energy in starting bathing the patient. Okay, I'm gonna remove your gown. Fills the basin with 3 to third full of warm water, 46 degree, and check the temperature of the water. Checking the temperature of the water is a must so that the patient will not get burns. So the water is already full now. Let the patient check the temperature of the water and make sure the patient can tolerate it. To know if the temperature of the water is tolerable for her. Okay, hold on, can you speak your hand and check the temperature of the water? It's okay. Remove patient's pillow, and the patient's condition allows raise the head of the bed to 30 to 45 degrees so that the pillow will not get wet in conducting the procedure. So I'm gonna remove your pillow. the face. Places the towel appropriately. First towel under the patient's head, second towel over the patient's chest to prevent the bottom sheet from making wet. So it's already placed. Wash the client's eyes with water only and dry them well. Use a separate corner of the washcloth for each eye. Ask whether the client wants soap used on the face. Washing from inner to outer corner prevents sweating debris into the client's eyes. Using a separate portion of the meat for each eye prevents the spread of infection. So, Amy, do you want to wash your face with soap? So in washing the patient's eye, first thing to do is soak the washcloth in the water and rinse it thoroughly and fold it to create a bath mitten, which is this. So in bathing the patient's eye, you should start from the inner canthus to the outer canthus using a separate section of the cloth for each eye. So next, wash, rinse, and dry the client's face, ears, and neck so that the face and ears and neck of the patient will be clean and they are refreshed. Starting from the forehead, then cheeks, nose, ears, and neck. Next, if the patient is male, ask them if he'd like to shave so that they will be able to know if the patient like that or not before proceeding with it. So next, unconscious patients. Washes the eye with plain water starting from the inner and outer canthus using a new section of the cloth in each eye to reduce potential infection. So for the unconscious patient, we should wash the eye with warm water starting from the inner canthus to the outer canthus using a separate section of each eye. If prescribed, instill eye drop or ointment if no blinking reflex keeps the eyelid closed to protect the eye from infection and blinking release a tear film, which mostly consists of water, oil, and mucus. Then, instill eye drop if prescribed. Closes eyelids gently and places patch or shield so that the patient eye will not get hurt and protect the eye. If the patient has no blinking reflex, then we leave the eyelids closed and place the eye patch or shield and on his eyes gently. Then we move in. So next, washes the arms and hands, exposes the patient's forearm and place the bath towel lengthwise beneath the arm in order to clean the arm of the patient. So I'm gonna place a towel under her arm. Wet soap rinses and dries the cover arm and axillae from distal to proximal. To clean the arm and axillae of the patient from distal to proximal. And then start to wash her arms in a distal to proximal manner, which means from the hand to the axilla. Using a long, firm stroke, I'm going to start to wash my patient's arm. Wet soap rinses and dries the hand and nails. To clean the hand and free the nails from microorganisms. Okay, and then into the hand and nails. And then have the patient place his arm over his head and lightly support it. And now I can start cleaning the patient's axilla. But first, I'm gonna start with the nails. Then, the other hand if needed. Please again. Do the same to the other arm, step 14A to 14C, in order to clean the patient's right arm and free from microorganisms. Now I'm done with the patient's left arm and I'm going to proceed to the right arm and do the same process. Next, washes the chest and abdomen. Spreads the towel across the patient's chest while lowering the blanket to the umbilical area to prevent the clothing from wetting and not give uncomfortable condition. Now, I'm gonna proceed to batting the patient's chest. What I'm gonna have to do is to drape over a bath towel over his chest or across his chest while lower down the back blanket just above his umbilical area. Lift the bath towel off the chest and bat the chest and abdomen with your mittened hand using a long firm strokes. Give special attention to the skin under the breast and any or other skin folds, particularly if the client is overweight. Rinse and dry well. Bath towel provides warmth and privacy. Using a bath mitt, start cleaning the patient's chest and of course pay special attention to the skin folds because these areas are very prone to sweating or perspiration and as well as known bacteria will drive us in this moist area. Dry the patient chest so that the patient, if it is female, then I should pay special attention to skin beneath the patient's breast. Okay, now I'm going to proceed at her abdomen and I'm going to drape another bath towel over his abdomen, moving the back blanket downward to his pubic region. So I'm gonna start to wash my patient's abdomen. So in washing my patient's abdomen, I'm going to cover the back blanket and pay attention to the obliques surrounding skin folds. Dry the abdomen gently and thoroughly. So I'm done drying it. So next, washes the legs and the feet. Expose the patient's leg farthest from you by folding the bed blanket toward the other leg. Being careful to keep perineum covered and place the towel lengthwise under the leg. For easily bathing the patient's legs and keeping the perineum covered is privacy of the patient. So in order for me to wash her leg, first thing I'm going to do is to expose her leg by folding the back blanket to the midline, keeping the perineum covered, and then place a bath towel beneath his legs. Wets, soaks, rinses, and dries the patient farther leg from distal to proximal to be able to start patting the patient's legs. Now, I'm going to start washing my patient's leg using a long firm stroke. I'm going to start to wash my patient's leg starting from the ankles to the knees and to the leg. As you wash the patient's leg, assess for any skin redness, swelling, bruising, or pain. Washes and dries the patient's foot thoroughly, applies lotion to the foot to wash the patient's foot and remove microorganisms in it. Okay, now I'm going to start cleaning for the patient's feet, toes, and toenails. Pay special attention to the skin between the toes and the toenails. And then apply lotion. Reverse the coverings and repeat for the other leg to clean and remove microorganisms of the right leg of the patient. Now I'm going to proceed to the right leg of my patient and do the same steps. Discard washcloth and maintains patient's privacy. To use a new fresh one for the patient's posterior side of the body of the patient. Now I'm done with my patient's anterior side of the body. Now I'm going to discard the washcloth and water and gloves that I've used and replace it with a new refresh one. Refills the basin with clean water to be used for the posterior side part of the patient's body. Next, changes clean pair of gloves and applies perennial care as necessary to use for the posterior side of the body. Changes the water and applies a clean pair of gloves to be able to start for the posterior side of the body assessment. Now I have done a new set of gloves and I have refilled my water basin with a warm water and also a new washcloths. Next, washes the back. Assist the client into a prone or side-lying position facing away from you. Place the bath towel lengthwise alongside the back and the buttocks while keeping the client covered with the bath blanket as much as possible. To be able to wash the patient's back and provide client his or her privacy. Now I'm going to assist my patient to a prone back side-lying position so that I can clean his back. Okay, I need you to face the left side. And I'm done also placing a bath towel at her back rather. Wash and dry the client back moving from the shoulder to the buttocks and upper thighs, paying attention to the gluteal folds. To remove microorganisms from the back of the patient and refresh his body through washing it. So now I'm going to start cleaning my patient's back and buttocks and paying special attention to my patient's info. Remember, if the patient's skin is intact, remove and discard gloves if used. Perform a back massage now or after the completion of the bath. Give patient pressures to give some relaxation to the patient, but you need to ask if the patient will like it to or not. If the patient's skin is intact, ask them if they like to be given a back massage. Okay? Would you like me to give you a back massage? Okay. If not, then apply a moisturizing lotion on the patient's back. Help the patient to put a new gown and checks the devices attached to the patient. To dress the patient again with a new gown. Okay. I'm gonna get you a new gown, okay? Okay, Ivy, now I have your new clean gown and I'm going to help you to read it, okay? Next, comb the hair properly. To free the patient's hair from tangle if only patient has a hair. So, okay, I mean now I'm going to comb your hair, okay? Places the signal device near the patient and thus aftercare equipment. The bottom is for the patient signal, the nurse signals for the nurse. If they want something, and care of the equipment for the cleanliness and or orderliness. So I need I'm done cutting you now from your head to toes and your back. How do you feel? Okay, good to hear that. Um, I am going to head out now and let you have some rest. Okay. Okay, if you need anything, don't hesitate to push that button, okay? So it signals that you want something from the nurse, and by that time I'll be here and provide your needs, okay? Okay. After doing the procedure, I am going to proceed to doing the aftercare of the equipment that I have used. Next, perform hand hygiene to free myself from infection and microorganisms. And next perform documentation and reports for any pertinent observations to have some documentation about what have you done to the patient assigned to you.